If you've ever dealt with abdominal pain, bloating, and dashing to the bathroom with diarrhea, or wishing you could because you're battling constipation, trust me, you're not alone. These are common symptoms of irritable bowel syndrome, or IBS, a frustrating digestive disorder that can negatively impact daily life. In this video, we're going to talk about IBS, what it is, common symptoms, how to know if you have it, and how to manage and treat it. Welcome to my channel. I'm Holly of Renewal Fitness and Nutrition Coaching. I'm a registered dietitian and holistic nutritionist specializing in gut health disorders and gut health for endurance athletes. So what is IBS? IBS is what we call a functional gastrointestinal disorder because the digestive tract is functioning abnormally even though no structural issues or damage are present. And for the rest of the video, when I say GI or gut, I'm referring to the term gastrointestinal or the digestive tract. IBS is characterized by a grouping of symptoms like chronic diarrhea and/or constipation, along with gas, abdominal pain, and bloating. IBS plagues about 10 to 15% of people worldwide, and it can seem to come out of nowhere. Symptoms of IBS can vary, but commonly include abdominal pain, which is usually relieved after a bowel movement, bloating or a feeling of fullness or swelling in the abdomen, gas in the form of excessive flatulence or belching, diarrhea or frequent loose stools, often with a feeling of immediate need to use the bathroom, constipation or difficult bowel movements, mucus in the stool, and changes in the frequency or consistency of stools. IBS is usually diagnosed with a subtype, either diarrhea predominant or constipation predominant, or mixed type, which is alternating bouts of diarrhea and constipation, or IBS-U for unsubtyped, when the symptoms don't neatly fall into one pattern or category. These symptoms and their triggers may change with stress, exercise, certain foods, and other lifestyle changes. IBS also commonly occurs with conditions like small intestinal bacterial overgrowth, inflammatory bowel disease, and celiac disease, which can add to the frustration and confusion when dealing with any GI disorder. So what causes IBS? While science doesn't comprehensively understand what causes IBS at this point, theories are that it can be caused by a mix of factors like stress, anxiety, abnormal gut movements, inflammation, heightened sensitivity in the gut, past infections, food poisoning, antibiotic use, and changes in the bacteria that live in our intestines. So how do you know if you have IBS? Unlike many gut disorders, IBS can't be tested for with blood work, colonoscopy, or endoscopy. There's no visual markers like pockets of inflammation, fistulas, or damage in the intestines that are found in other GI disorders, and this can make it trickier to diagnose. When it comes to diagnosing IBS, other more serious conditions must be ruled out because symptoms often overlap, like I mentioned before, with diseases like celiac disease, IBD, or even colorectal cancer. So a thorough evaluation by a healthcare professional is essential. Working with a gastroenterologist is particularly important. Gastroenterologists specialize in disorders of the GI system and can provide a comprehensive assessment that considers both IBS and other potential diagnoses. Once other conditions are ruled out, doctors typically rely on your symptom history and guidelines like the Rome-4 criteria, which focus on how frequently you experience symptoms and how long you've had those problems. What if you're diagnosed with IBS? If IBS is confirmed, a tailored treatment plan will be developed. Collaborating closely with a gastroenterologist and a qualified registered dietitian can dramatically enhance the management of IBS and improve overall well-being. Your treatment team may also include a therapist or psychologist who can work with you on stress, anxiety, or mental health issues contributing to GI upset. A dietitian can help you discover your food and lifestyle triggers to reduce symptoms and help regulate bowel movements. They can also help personalize a diet that allows you to enjoy food without so much pain and uncertainty. I recently worked with a client who, after just one session, had a dramatic reduction in diarrhea and pain by identifying potential triggers in her diet and making minor changes to her daily foods. Another reason to work with a dietitian is that IBS can result in nutrient deficiencies or malnutrition due to people only eating safe foods and eliminating nutrient-rich foods. If you need this kind of guidance and support, you can contact me for a free nutrition consult at RenewalFitCoach@gmail.com or learn more at my website at RenewalFitCoach.com. Before we hop into how to treat IBS, is this video helpful so far? If so, please give it a like and subscribe to my channel so you don't miss any future gut health related videos. When it comes to managing IBS, there's no one-size-fits-all solution. It usually involves a combination of dietary modifications, lifestyle changes, and possibly therapy and/or medications. But here are 5 key areas that you can explore to manage IBS. Number 1, stress. IBS tends to be linked with stress, anxiety, or dysfunction in the gut-brain axis. When stressed, the body releases hormones that can affect digestion and gut motility. Stress and anxiety can trigger changes in gut function, leading to abdominal pain, bloating, and changes in bowel habits. Stress can also heighten sensitivity in the gut, making it more reactive to normal digestive processes. This can amplify the pain and discomfort associated with IBS. Chronic stress can affect other lifestyle factors that are important for managing IBS, like sleep and physical activity. Poor sleep quality and lack of exercise can worsen symptoms, creating a cycle that can be difficult to break. Studies have shown that stress reduction techniques like mindfulness, prayer, yoga, meditation, cognitive behavioral therapy, and regular exercise can significantly improve symptoms. These techniques can help train the body to respond better to stress, reducing the impact on digestive health. Even deep breaths before and during meals can help calm stress and activate your parasympathetic nervous system, or the rest and digest system, for better digestion. Number 2, diet. Many people with IBS find success with the low FODMAP diet, which stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are all fermentable carbohydrates that are poorly absorbed in the intestine with IBS. Some examples include garlic, onion, wheat, milk, yogurt, sugar alcohols, honey, and certain fruits and vegetables. A short-term diet low in these FODMAP carbohydrates can give your GI tract a break from digestive upset related to fermentable carbs and reduce symptoms. The low FODMAP diet also helps by identifying food triggers through a 2 to 6 week elimination diet. After the elimination protocol, you begin to reintroduce specific high FODMAP food groups in specific amounts, which helps you identify your specific food triggers so you can personalize your diet and know which foods to avoid and which foods to keep in your diet. An IBS dietitian can show you how to do this properly and give you nourishing meal ideas during the diet. We can also help you decide if a full elimination diet is really necessary or if what we call a gentle approach would be more appropriate. We can also help you plan a long-term healthy diet that includes the FODMAP foods that you find you tolerate well to ensure you don't become malnourished or nutrient deficient. While I always recommend the personalized help of a dietitian, I also have a low FODMAP diet how-to guide and meal plan on my website. This can help you get started or follow the diet without needing so many one-on-one sessions, helping you save time and money. And I'll put the link to that guide and the meal plan in the description below. Number 3, exercise. Regular exercise can play a huge role in keeping your gut happy, promoting good gut bacteria, and reducing stress. The best options include enjoyable movement like long walks, yoga, Pilates, dance, strength training, light jogging, easy cycling, swimming, and other low-intensity exercise. It's usually best to hold back from frequent high-intensity or long-endurance exercise while working to reduce symptoms of IBS because these can be more stressful on the gut and digestion. Number 4, vagus nerve activation. Simple pleasures like singing and humming can help to activate the vagus nerve. And this nerve plays a crucial role in the body's parasympathetic nervous system, which helps regulate digestion, heart rate, and mood. It connects the brain to various organs, including the gut. So activating the vagus nerve through singing and humming can actually improve digestion and reduce stress. Number 5, peppermint oil and tea. Many people find symptom relief by incorporating natural, holistic remedies. For instance, peppermint oil and peppermint tea have become popular for easing IBS symptoms because it soothes the stomach and relaxes intestinal muscles. It's often taken in enteric-coated capsules to avoid any GI side effects. But do note that if you have acid reflux as well, you should probably avoid peppermint oil and tea, as this can make acid reflux worse. Number 6, laxatives and medications. Senna, Miralax, or psyllium husk can help with constipation and related bloating. Some prescription medications are specifically approved for IBS, which may help if other diet and lifestyle changes or gentle supplements haven't solved the problem. Keep in mind that medications and herbs are typically treating symptoms, not treating the root problem. While having IBS can be very challenging, finding the right mix of stress and anxiety management, diet, exercise, and holistic and medical treatments can lead to a much better quality of life. A well-rounded approach and patience can help you regain control and start feeling like yourself again. If you'd like more help or need personalized guidance, feel free to contact me for a free consult at RenewalFitCoach@gmail.com. And as a reminder, you can purchase and download my low FODMAP diet how-to guide and meal plan from my website at RenewalFitCoach.com. And I'll put the direct link to that in the description. And until the next video, blessings on your health and wellness journey.